A nose that's clogged with mucus can make it hard for babies to breathe and eat properly, especially for young babies who breastfeed or eat from a bottle. In this episode, I'm going to share with you my top tips for removing nose gunk. Hi, I'm Dr. Sinan, the GP, your source on all things health related for you and your family. So first things first, babies can't blow their nose like adults can. Kids usually need to be around 3 years and above to learn to blow their nose and clear it out. If kids are younger than this and you suspect they have a blocked nose, we need to be a little more creative. There are 4 main options to try. I've used them all on my 3 kids, and I'll tell you which one I think is the safest and does the job. All can be done by yourself without the need to see your doctor. All of them are a little unpleasant for baby and parent, but if you do it more than once, kids tend to learn that it's actually good for them and it helps them breathe and sleep easier. The first is the bulb syringe. If you've not seen them, they look like this. You basically squeeze the air out of the bulb and keep it squeezed, and then place the tip in your child's nose and slowly release the bulb. This creates a type of suction or vacuum effect that helps to remove the gunk. If your child's nose is runny, you should be able to suck out some of the gunk directly. But if the boogers are hard and congealed, you should soften them with a saline solution, either in the form of a spray or drops. Do remember to clean the bulb between uses and only use it a maximum of about 4 times a day, as it can cause a bit of nasal irritation, especially if your baby is fighting you. The second tip is a nasal solution. We've already actually touched on this, so I'll cover it now. You can buy drops and sprays for babies to help loosen thick mucus. You don't need a lot. A few drops or 1 spray in each affected nostril will do the trick. This may actually help just by itself, especially if it induces a sneeze, but more often than not, you'll need to use something like a bulb syringe to help suck out the gunk. You can make your own saline solution too, with about 300 ml of warm water and a 1/4 teaspoon of salt. As an alternative, if you're breastfeeding, you can put a few drops of breast milk into your baby's nose. This also works really well. It's easiest to apply the drops or the spray with the baby lying flat. Give it a minute to kick in and give the baby a breather before you remove the gunk with an aspirator. Don't use the saline solution for more than 4 times a day, as it can also sometimes dry the nose out. The third way is a nasal aspirator. So the bulb syringe is probably the commonest option people try, but I found that the safest and most effective tool to remove boogers is a nasal aspirator. This is what an aspirator looks like, and it comes with a mouthpiece, the red part, that's attached to a tube with a narrow tip. There's also a disposable filter to prevent suctioning gunk into your mouth and to stop you sucking too hard. It's pretty straightforward to use. Place your baby on their back, put the mouthpiece in your mouth and place the narrow tube tip against the opening of your baby's nose. Don't place it too far inside, but it's important to try and make a seal with your baby's nostril. Then suck through the mouthpiece gently to begin with, and you should start to see some mucus appear. Yeah. Also with this, don't use it more than 4 times a day. You probably don't need it more than that anyway. And make sure to wash between uses with soapy water. I've actually been using this one for about 8 years now, and it's done the job well. It may seem a little brutal, but it is quick, it is painless, and it works. And babies tend to learn that it's good for them pretty quickly, but they'll still kick and flail and bite, so do keep your wits about you. The brand that I have is a nose freeder, and there's a link in the description below if you want to find out more. The fourth option is using a distilled water syringe. This is where you flush out the nostrils with a larger amount of warmed and distilled water. I have used this and it does work, but I don't actually recommend it as it's a bit more unsafe than the other methods. Squirting water into a baby's nostril can cause problems, so it is best avoided. One of the common treatments we used to use for earwax, for example, was called syringing. This is exactly the same thing, squirting water into the ears and flushing out softened earwax. And it worked, and we used it daily in clinic, but now no one really does this as it causes ear irritation or sometimes even a hole in the eardrum. And that's what water squeezed at high pressure can actually do. And I guess that's the point and why I don't recommend this option for the nose. But I have to say, when I've tried it, it does work, but not much better than the nasal aspirator. Learning how to properly and safely clean your little one's nose can make them much more comfortable and can be the difference between a better night's sleep for them and for you. On top of this, there are a few other tips and tricks that you can try, such as using a humidifier. This produces a type of steam which you can leave running all day, which helps to break up mucus too when your kids breathe in. A warm bath can often help to loosen and clean out nose gunk, but do avoid this if your kids have an active temperature. And the last thing is hydration. Drinking plenty of fluids helps to make kids feel better and it helps to loosen the mucus. But don't worry, if nothing's working, don't beat yourself up. It's not dangerous to have this buildup of gunk in your nose, and of course, eventually it will resolve naturally. If you found today's topic useful, don't forget to share with your friends and family and click the subscribe button to stay in the loop. You can find out more at drsinanthegp.com. If you have any questions or comments or suggestions for future topics, I'd love to hear from you, so do message in the comments below. Thank you so much for watching. Till next time, stay healthy.